Welcome. I'm Michelle Reed, the Housing Program Coordinator with Social Services and Mental Health.
And I'm Abby Guilford, Grants and Contracts Coordinator with Social Services and Mental Health.
Today we want to introduce you to the Anoka County Coordinated Assessment System. The purpose and intention is to give you a general idea of what coordinated assessment is and how it will function in Anoka County. So what is coordinated assessment? Coordinated assessment is a national initiative driven by Housing and Urban Development, or HUD. It's a new approach to accessing housing resources for persons who are homeless or at risk of being homeless. And it really is a coordinated referral process for clients to receive prevention resources, housing, and or related services. And this is led by the continuum of care in each region. The goals of coordinated assessment include creating a client-centered system by simplifying and streamlining access to assistance, to reduce the length of time a family spends homeless, to provide connection with the most appropriate level of assistance needed, to transition from homelessness to stable housing. It also allows for transparency throughout the system, and there is an ability to easily identify gaps in the resources. Whereas coordinated assessment is a HUD mandate, our local Anoka County system was created from the ground up. Starting with Anoka County housing providers, the planning group looked at what would best serve the community. Anoka County is part of a larger continuum of care. The Suburban Metro Area Continuum of Care, or SMAC, created common policies and tools to assist in developing the coordinated assessment process, thus ensuring consistency throughout the SMAC region and providing additional guidance at the state level and finally to HUD.
Current access to housing resources is complex and cumbersome for clients and staff alike. There are multiple doors and eligibility criteria is often unclear. The map on this slide illustrates the streamlining of access to resources for the client. It lays out the process from client entry through placement with a housing provider so as to match each client with the appropriate housing resource. The components in Anoka County's coordinated assessment process are as follows. Step 1 is a housing assistance screening, or, as indicated on the map above, a prevention screening. Step 2 is a supportive housing assessment. Step 3 is a centralized wait list. And Step 4 is referral to housing providers. These steps will be gone through in more detail in the coming slides. Step 1, the housing assistance screening. This is a common screening tool that was developed locally to ensure available Anoka County resources are maximized. It will determine if the household is homeless, in need of prevention or shelter services. If the household is not determined homeless, information and referrals will be provided.
The Step 1 Housing Assistance Screening Administration. Trained housing assistance screeners will be identified throughout the county. If your agency or organization is not a trained housing assistance screening agency, households will be referred to an appropriate point of access.
Step 2, the supportive housing assessment. This assessment will determine the level of need of the household. They will receive a numerical score from 0 to 20. The numerical score will indicate the type of housing that will best fit the household's needs. The assessment tool to be used will be the Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT. This tool was created by Ian DeJong. It has been nationally tested and is determined to be reliable and valid for determining household level of need.
All Step 2 assessments will be done or will be completed by a point of access. The family point of access is Salvation Army, the youth point of access is the YMCA, and the single adult point of access is Stepping Stone Emergency Housing.
Step 3, the wait list. The wait list will be managed by Anoka County Human Services. Households will be prioritized based on their Step 2 assessment score and their assessment date. The placement team will make determination of household eligibility and referral. The placement team will consist of the COC coordinator, the waitlist manager, all points of access, a supportive housing provider, and a community outreach worker. The waitlist manager will communicate with the housing provider to make a household referral. Clients have the right to refuse referral. Anoka County has already determined the eligibility for each program and will match appropriate person to program. Step 4, referral to housing providers. Providers of supportive housing, for example RISE and ACAP, will not be holding their own waitlist. All referrals for supportive housing programs will be funneled through the coordinated assessment system. You may wonder then about emergency shelters. They will continue to maintain and manage their own waitlist. Policies are being developed and will be enforced for those agencies who circumvent the system. Housing provider will contact client for formal intake process and collect necessary documentation after receiving a referral from the centralized waitlist. Households will be moved into housing if found appropriate and eligible for the program. Our implementation timeline is as follows. We will begin our pilot on October 1st, 2014. We expect this to be a fluid process that will require feedback and evaluation at multiple steps along the way. We plan to reevaluate the system at 6-month intervals.
In closing, we thank you for taking the time to educate yourself about what coordinated assessment has to offer. We appreciate your partnership and collaboration to have the system be an efficient one.